Well, the deadline is fast approaching for more than 1.5 million Georgians to decide if they want to keep getting health insurance through the Affordable Care Act.
Thursday is a cutoff date here, but the costs for millions of Americans are skyrocketing with the loss of these ACA subsidies.
That's right. 11 Alive's Galat Malamed is live in Atlanta with the impact the rising cost is having.
According to federal data, about 1.3 million Georgians have enrolled in marketplace coverage so far for this year. But a Metro Atlanta man I spoke to says he can't afford to continue his coverage as he fights cancer because his premium more than doubled. Ross Coleman's beginning the new year with health insurance sticker shock.
With the subsidies ending, it's skyrocketed.
He says his 2026 Affordable Care Act monthly premium more than doubled, now quoted for nearly $600 a month. It's a price he says he can't pay.
Still unable to return to work with this level of pain and this wound the way it is.
Coleman has skin cancer and says his arm has to be amputated after a wound from a previous surgery didn't heal. He says without insurance, the bills can pile up.
Over 2025, it's been about $250,000 to $300,000 in medical bills.
That was mostly covered by insurance.
Now I'm in need of the necessary surgery, and I have nothing to. I have no coverage for that.
Hundreds of thousands of Georgians lost a COVID-era Affordable Care Act subsidy that Congress did not extend into 2026. Cynthia Cox with KFF, a nonpartisan health policy research group, says millions of Americans saw their premiums increase.
Some of them may have already dropped their coverage. Other people may have tried to switch from, say a silver or a gold plan to a bronze plan, which would have a much higher deductible, but might keep their premium low enough that they could afford to stay insured.
The bill is passed.
The House voted to extend the subsidies last week. It is not expected to pass the Senate. Coleman, though, continues to hope leaders find a solution soon.
Honestly, I'm just hoping for outreach, for community, and hoping that our politicians can communicate better and communicate effectively and reach a viable conclusion.
For people who can't afford their current plan, AARP recommends checking lower tier plans, seeing if you qualify for Medicaid, and looking at going to community clinics for routine health care because they typically offer free or low-cost services. Live in Atlanta, Galat Malamed, 11 Alive News.
Galat, thank you.